welcome to the Town of Littleton Board of Health meeting for May 28th, 2025. In attendance from the board tonight are Kevin Davis, Dan Kane, and myself, Matt Wason, as well as our health director, Francis Daigle, and our health agent from Neshoba, Jim Gareffi. The first agenda item we have is our 7 o'clock vote on reorganization of the board. We have a quorum, but only 3 of our 5 members in attendance this evening. How does the board feel about this agenda item right now? Or should we try to wait to see if somebody else joins? I have no notification that anybody was going to be absent tonight.
Gino did not pick up his packet, so I'm not sure if he's going to come.
Thank you. Kevin?
I say we wait to see who else is going to be showing and work through it that way.
Very well. We have 4 minutes then. Let's just kind of push that off for a bit for our next public.
Right now.
Kevin, good evening. We were just saying that we wanted to figure out the reorganization of the board, but wanted to make sure we had more people present. It looks like you're now joined us, but that Gino might not be joining us because he did not get his paperwork. So we can still hold off and see if he joins in a little bit. I think that would make sense. There's no reason to rush it. So how about for the next 4 minutes? Do we have any member updates, or Francis, do you want to give us any updates right now?
Sure. So for the public health nurse, we have extended an offer, and I believe it has been accepted. So we'll be ready to go on nursing on July 1st.
Terrific.
We also were part of the interview panel for the new assistant conservation agent for the town, and we extended an offer today for that as well. So they'll be starting in the next couple of weeks.
Well, at least on the public health nurse, you've been considerably more successful than this board was without you, that's for sure. So thank you very much for figuring out a solution and getting us all the way to, knock on wood, hopefully a hire, all in not that long of time, frankly, for such a feat.
Yeah, I think she's going to be great. She'll be at the next meeting in July.
Terrific. Any other updates?
The fee schedule is still with legal counsel. They did come back today with some additional questions. I already answered them, so I'm hoping it will be wrapped up by the end of the week so I can send it out.
Awesome. And as a part of that, I know that they'd done some write-up in terms of like kind of the key line items and what the concern was. And so similarly, if you just want to kind of help us focus and just key line items and what the change or whatever it is, what action you're recommending, so we can review it faster.
Yeah, so it'll be a comparison between what was previously approved and what's being proposed, items that might be cut. And we also put Neshoba on there as well to see a comparison for that.
Awesome.
Just get a general idea of how the fees will change July 1st.
Okay. Our next meeting is going to be June 11th. So do you want it on the agenda for that, or do you still want to wait for give legal some more time to get back to you?
I'm hoping these were the last round of questions. They weren't as specific. They were kind of more broad. So I think they're finishing up. So I hope to have it by the end of the week, if not early next week. So I'll definitely put it on the agenda for the 11th.
Okay. How about, just because I know it's lengthy and I think it would behoove to have a little review time in advance, how about if you don't have it by the 4th, we just bump it to the next meeting?
Sure. Okay.
So that this, because that way you could get it out to this board at least a week before we're going to meet, if you could, so that we can have time to glance at it, review it, see if we have any offline questions before we dive in. I don't want to bring it up at this meeting and end up spending an hour and a half discussing minutia. If we can clear anything up in advance.
Makes sense.
Thank you.
Question?
Mm-hmm.
Yep.
Did after their comments, I remember when we were in the meeting, several other comments were around that some of the they didn't believe some of the fees were backed by either something we had in the books in town or something at the state level, so it was defensible. Did we give them sites for each of the different fees, and so that way they could see where they were coming from?
We did for the fees that we can charge for. Some of them had to be removed.
Okay. Was it a large percentage of those, or was it just a small number?
The food fees are cut down a lot, and the treatment plants are cut down, and hazardous waste is cut down as well.
Okay. Thank you.
And at our meeting, I think we can discuss this if we feel like something with Francis's recommendation does warrant some sort of coverage and fee that we need to then create a regulation for. That'll be a next step. All right, we'll pause on the rest of that discussion. We will go to our 7:05 public hearing on 2 Elmwood Road. We have somebody in the audience representing that project.
Yes, I am.
All right. We get you added to our group. All right, Dan, if you could introduce yourself, and then you should be able to share your screen to show us your project.
Sure. My name is Dan Wolf. I'm with David Ross Associates, and I'm representing the owners of 2 Elmwood Road tonight, Daniel and Rachel Duarte. They live at 2 Elmwood Road in an existing 4-bedroom house, and they've got a very old, I believe it's a cesspool in their backyard, and it's time to get that upgraded to something more advanced than a cesspool. So good timing. What we had done is we've gone out there and done soil testing. Results were very good with the perk rate. Groundwater was not as deep as we had hoped. And the reason for that is we were hoping to make the system gravity fed, so we wouldn't have to have a pump system. We did design a conventional leach bed, and we were not able to make it a pump system. So what we did is went back with a plumber, figured out how high we could raise the plumbing, and it still wasn't enough to avoid a pump. So the suggestion was made that we use a Presby system. And as I'm sure the board is aware, with the Presby, the DEP approval allows us to reduce the groundwater offset by as much as 2 feet. So that's what we've done. It allowed us to get the system in the ground. There is still an adjustment that needs to be made to the plumbing in the house, but with that adjustment, we can now feed the system by gravity. And the real strong point about that is not only cost, which is a homeowner's big consideration, but to eliminate the need for a mechanical type system that is subject to failure at any time. So this would be a better all-around system using the Presby with a 2-foot groundwater offset. I'm sorry, a 3-foot groundwater offset. And we've just come before your board to ask permission for that. I believe Jim has already reviewed the plan and doesn't have a problem with it, but I'll let him speak to that.
Dan, are you able to share your plan on your screen so we can see it, and you can walk us through a little bit and explain what it is?
Sure. Are you able to? Okay, let me find the share. There it is. All right.
We can see it.
Great. Excellent.
But
so again, it's
if
a
you
very
could zoom in a
small...
little bit on the area you're describing. Thank you.
All right. You're able to see that all right? Trying to move the screen over. Okay, you're able to see that, correct?
Yes.
Okay, so we've got a relatively small lot, so we didn't have a lot of flexibility The lot is 0.36 acres, about a third of an acre. And as I mentioned, the existing cesspool is directly behind the house in the back here. We went just beyond that, did a couple of test holes there, which, as I mentioned, had good results. And this is the layout of the Presby system that goes in there. And we've got a gravity feed from the house through the septic tank and into the Presby system. So it's very straightforward. This house, by the way, is on town water, which is in the front yard here coming from the street. So has that prompted any questions on your part?
Potentially, we'll go ahead and go to Francis and to Jim for their kind of evaluation and comments.
Jim?
Sure. So I did the soil testing or witnessed the soil testing out there. Again, it's a cesspool, and based on the depth that we were told of the cesspool, likely sitting in the groundwater. So that's going to be removed. It's on top water. So, putting the Presby system in, which provides a little bit of treatment, according to Presby, and getting the system above the groundwater from a public health standpoint is going to make a big difference on that site. Avoiding a mechanical component like putting a pump in there, again, provides a little less of a headache for homeowners down the line. So I think overall, from the public health standpoint, it's a much better situation.
Very good, thank you. Questions from the board? Kevin Davis?
Couple of things. Are there any variances that you're asking for?
No, there are not.
No variances. How many feet from the lot lines is the Presby?
It's about 15 feet there to the closest lot line.
Okay. And we're just leaving the cesspool in place and just letting nature do its course, or are we pumping that out? Or
Nope, it is detailed on the plan that the cesspool will be pumped out, and then that cavity will be filled with clean gravel fill.
Okay. I didn't see that note. I'm sorry. That's all the questions I have.
Thank you. Dan Kane, questions?
I'd say other than the change of the offset from the groundwater, doesn't look like there's any grading changes to the property line or anything, right?
That's correct.
Okay. Nope. I don't have any questions. Thank you, sir.
And Kevin Baker?
I can't see it on the plan. I'm just curious what the high groundwater was called at and what the perk rate was.
Yeah, we had 2 test holes out back there, and we estimated it at 7 feet.
Good. And what was the perk?
The perk was 2 minutes per inch. So really nice sand material. So very.
So they made you go to 3 feet. Then you could have done 2, but
yes, with 2 minute per inch soil, we need a 5-foot offset, and the Presby approval allows us to reduce that by 2 feet, resulting in a 3-foot total groundwater offset. Yeah.
great. Thanks for the information.
All right, thank you, Kevin. And I was just glancing at that. There are no wetlands nearby here, right?
No, not at all.
Okay, that's what I thought. I have no other questions. We'll entertain a motion from the board.
Mr. Chair,
Yes, Kevin.
would you like to check for abutters? I don't know if that's
Oh,
Yes.
apologies. Do we have any abutters in the audience or any members of the public that would like to make a comment or question? There are no other attendees.
Mr. Chair.
Go ahead.
I'd like to make a motion. I'd like to make a motion to approve the plan as presented.
I'll second.
We have a motion and a second. Roll call vote. Kevin Davis,
Kevin Davis votes yes.
Dan Kane,
Dan Kane votes yes.
Kevin Baker,
Kevin Baker votes yes.
and Matt Wason votes yes. Your plan is approved. Good luck with the project. Thank you.
Great. Thank you very much. Have a good night.
You too. This takes us to our 7:15 p.m. public hearing on the basements and additions regulation. Francis, can you get us started where we're at?
Sure. So based on the last meeting, it was recommended that this could be brought to a public hearing stage at this point. So we are in the draft here. Anything in red is either things that were still outstanding that we're looking for more present board members to comment on, or they might be new items added. You're on mute, Matt. I guess we could go right to the question of egress. There seems to be a divide on the board. Matt, you're on mute.
Can you display it? Can you share it for us so we can see?
Sure.
Thank you. Yeah, so the first red is a little lower down there in the for dwelling section. Right there.
Yep. So that's new.
Existing dwellings with ceiling heights. I think this is just valuable detail. We kind of had a lot of discussion about, well, how do these 7 foot and 7'3" rules apply and building code, et cetera. So I think that's a reasonable kind of little call out to say, based upon the existing, they can still be counted. So that's our out if we find some plan that falls in this gap of it's pre-existing, so it didn't used to count or it does count now, et cetera. Does that make sense? So I think we should just leave this detail kind of in there like that. Does that work? Okay. I see nodding heads. So keep going now.
And just to notice we're scrolling. So after tonight, this will be sent to zoning and planning board and conservation for review, and then we'll get their comments back as well.
Awesome.
I should have made it in red, but the accessory dwelling units is also new. In terms of the definition, is from the Affordable Housing Act for the ADUs, and also incorporates 1,200 square feet instead of the 900 square feet because Littleton has provision for 1,200 square feet instead.
Going back to points 1 and 2, it's all about the structures. Was there the discussion at the last meeting, apology, I was not present, that we're going to stick with these structures with 8 rooms as opposed to septic system size as the starting point for the definition?
I believe so.
Okay. Very well. We can keep going.
Okay. Any questions on the number 3, since it's fairly new, the definition, or questions on the flow of 110?
No, but I appreciate you putting that in there.
Is a design flow of 110 gallons per day per bedroom shall be used to determine septic design. Oh, okay, never mind. It says for ADUs. All good. Never mind.
Is that the same number as calculated for any bedroom in the house?
It is.
Okay. But we're calling that out specifically instead of just saying that it counts as a bedroom, or it could have more than one and it's going to count that way.
I think it's just to make it clear that that's what it is counted for, because people are going to think that ADUs are separate than anything else, but in terms of bedrooms, it still has the same flow. So
Okay.
Call
And
it
so
out.
it says per bedroom. So if somebody manages to make an ADU with 2 bedrooms, then it'll count as 2 bedrooms
correct.
With 110 gallons of flow per day.
each. Okay.
Mr. Chair.
Yeah.
I just think that 110 gallons is important because typically, an ADU might be used for an older relative or senior, and those flows are half that, I believe. Or Jim, correct me if I'm wrong. Are they 55 or?
If you're designing a unit for, they call it housing for the elderly, it's 150 gallons up to 2 bedrooms. It's a weird kind of number.
Fair. So somebody could try to say it should be only 75 for my 1-bedroom ADU. Okay.
Yeah.
Good. Thank you for that note, Kevin. That's an important call out there. Basements.
So the big question last time is, does a walk-in, should that be considered?
Kevin, go ahead.
I do think a walkout should trigger Board of Health review in the instance that it may want to be looked at from the perspective of an ADU and follow those rules and regulations, and perhaps be on the list of dwellings that the town checks on. I think it's on a 3-year every 3 years to make sure that it's being used appropriately. However, I don't believe it should automatically trigger a bedroom determination.
So ADU should be self-contained, but that doesn't mean you wouldn't look at this as an in-law suite or an apartment. But the ADU rules, as it were, wouldn't apply. I don't believe. Is that correct?
I don't know why they would unless it was triggered somehow and applied for directly in that way. I'm unsure.
Okay. And in this list, it's the kind of 2 or more features, and it's vague language because all it says is shall trigger review. And I'm not sure if we want to keep it that vague. It doesn't give us a whole lot of concrete ground to stand on, so then it just becomes whatever the board does as precedent over multiple reviews. This just came about because it's when you start to have more and more features, as it were, that make it look like you have an in-law suite or an apartment, should that come before this board for more thorough review? There's been a lot of feeling about the egress portion of it, and so I know Kevin Davis has spoken against that, and if he wants to provide some additional detail, he can. Or if Kevin Baker, were you just saying you don't feel that the egress should be on there as well?
I don't think it should be 100% determination factor in whether it's counted as an additional bedroom. But I do think that if there is an exterior access, it should be looked at from an ADU perspective. So I'm in agreement with the first red bullet point in number 2, but not in number 3.
Okay. Kevin Davis, you had your hand up.
I will pile on to Kevin Baker, and that I have no problem with triggering a review with walkout, but absolutely disagree with the exterior egress in number 3. Also, I have a problem actually with all of number 3. But
Can you pause on that for a second then? Okay. Is there any other problem with 2.2? Dan, you haven't said anything. Do you have a problem with the red line on point 2?
All it does is prompt a little bit closer review from us. It's not a mandate that we take some action. I think that's fine with number 2.
Very well. Francis, number 2 is set. Now,
Okay.
moving to number 3, bedroom determination basement. So numbers 1 and 2 are just talking about spaces and hitting a square footage mark, right, of 400, and then saying, well, and then if you have some other features going on, then the board is going to review it. Now, point number 3 is talking about bedroom determination. So if a basement modification includes these items, then the basement configuration shall be presumed to include an additional bedroom. Kevin Baker, you started. Say what you want to say about this part then.
I don't believe an accessible exterior egress should be the determinant of whether finishing space in the basement is adding a bedroom.
Okay. Kevin Davis, you also wanted to say something?
hitting the mute button would be helpful. So I actually think definitely the exterior egress should not be there. I'm trying to recall the conversation around why we would say that if we have 2 or more and a bathroom, then the basement configuration shall be presumed to include an additional bedroom. What was the conversation around that? I don't remember that part.
I'm interpreting this as kind of a follow-on from number 2, which is the shall trigger review, to basically make it more clear that if you have these kinds of features and you've divided up your basement and you have an exterior door and you have a bathroom and you have some rooms, then you're automatically going to be counting something as a bedroom. I'm not sure. I don't think the language was specifically called out to say we must have this. But that's how I'm interpreting it to be there. Francis can add some more detail, I think. But so I'm not sure if we need to say something or if this is trying to guide the board in how to deal with the trigger from number 2. But it becomes the when do you no longer look at a basement as a basement and start applying main floor rules to it? That's how I read this. And if that's the case, then do we want something that's more concrete that tells us when to do that? Or do we leave it as the prior, which is shall trigger? And the concern there is that it's not concrete, and then it's whatever cases come before the board just creates the precedence. Baker, you had your hand up?
I feel like each scenario that comes before the board is so unique. And, they might have extra flow. They might not have a dining room. They might not have, I just think it's to put out a blanket statement stating that division into 2 or more closed spaces and a bathroom is very black and white. And if it's something we're going to use as almost a regulatory tool, we might just want to consider all the different unique properties that come before us before we handcuff ourselves into having to do something.
That's fair. If I may, I would throw out that maybe the thing to do would be to say, instead of calling out something that's concrete in number 3, perhaps just a footnote to number 2 along the lines of spaces that could be considered apartments, in-law suites, or the like may have, main floor bedroom count rules applied to them, or something like that. I'm a little worried about just leaving it just at number 2 and ending and saying nothing else, just because what is that review? We have no guidance in writing then of what that review should be and what it should say. So would that be fair to kind of, instead of talking around it, call out specifically that if it looks like you're creating a space that could be a separate living space, then the board is going to evaluate it as living space, not as your basement exercise room anymore. Davis.
If you change the word shall to may in that third sentence, it says bedroom determination in basements. If a basement modification includes, strike the first bullet, a division of 2 or more enclosed spaces, a bathroom, then the basement configuration may be presumed to include an additional bedroom. That leaves us the wiggle room to look at it and say, oh no, they're saying it's an office, they're saying it's this. By saying it's a shall, that is it must be. Whereas if you say it may, then you can take the approach as guidance, not as a requirement.
Then let's keep then the basement configuration may be presumed, but seriously, change the language above it, which is basically a cut and paste of the prior bullet list, and just go based upon the prior bullet list that says, if you have these things, it's going to trigger review. And by the way, part of that is the basement configure may be presumed to include adjustment. Does that make sense?
As long as the word shall, in my mind, goes to a may, then you're not saying you are increasing a bedroom right away. It's up to the board to do that review and to have those features looked at. That's the way I read it. And you could actually get rid of the 3 thing. Basically you could say, following review, the outcome of the review will be, then the basement configuration may, be presumed to include an additional bedroom. You can just add a sentence at the end of that number 2.
That's the way I'm leaning. And I think it would be a good idea to, like I said, use the word apartment, in-law space, etc., just so that people read those words and understand that that's kind of what we're talking about. That's why we have this criteria list here. That's really why it exists, because we don't want you creating a potentially separate living space that's going to potentially cause problems with some future owner.
Does that? I guess in my mind, as long as we're not mandating it, making it a requirement with shall and going with may, I'm okay with that.
That's all I'm saying. I'm just saying, as a call out to why are we triggering a review? I feel like it's unfair to just leave a document, a regulatory document that says shall trigger a review. What is the homeowner supposed to do with that information? How will they have any idea? And so I'm just trying to say, let's clarify why we're asking for the review. And it's basically because we don't want to let another living space get created. FYI, it may have to include an additional bedroom if you go down this road. I agree. I don't need shall there. I'm just trying to get that detail. I'm trying to get between the two of just saying trigger and saying shall. Can we say trigger because and thus it may? Clear?
Clear. When you have the following, then the basement can trigger it may be presumed to include an additional bed.
Right.
I have no problem with that. But
Awesome.
Shall, absolutely not.
Fair enough. Kevin wants to say something.
Do we know when an ADU gets triggered?
I thought an ADU has to be. Can it be physically incorporated? Tim says yes.
Yes. And so I think it gets triggered when somebody says, I want to put an additional living unit in the house. And I have this right under the ADU regulation. So I think that's where that gets triggered. There's additional kitchens don't necessarily trigger additional living units. There's some rule that was settled. Ernie Bach had a house down the Cape and had a kitchen in the basement for it. And I guess building inspectors will tell you about that one. So the kitchen in and of itself wouldn't make it a separate unit.
Okay. Is it fair to just list that again in a potential, if you're trying to create an in-law suite or an ADU or an apartment then again, that's what the trigger is about, and so you'll have to have a review. It's not saying you can't do it. And it's not, I wouldn't see it as like a loophole to break the rules, because if you're doing an ADU, you're still gonna have to count the bedroom. And so your system still has to be the right size. That's almost a more formal way of doing it that I wish people would do if they wanted to create something like that. Just admit that it's an ADU and we can deal with it. If you try to just show us a drawing that has a bed in a room called the office, then that's a different situation. Dan Kane, input?
I'm okay with may. I hate regs that are mays, because it's, then why do we have it? It's a regulation that says may doesn't really tell you anything. It's a guidance more than a reg. So I'm a little bit concerned with may, but I can live with that. I know we've gone back and forth with the accessible exterior egress piece. I mean, any basement living space has to, by fire code, have egress. So, are we count? I want to make sure that our definitions are accurate. Is that accessible exterior egress a fire code compliant escape window, which would be considered an exterior egress, or are we really thinking of walkout, whatever walkout means? Is that a bulkhead? Is that stairs and a traditional doorway with like canopy thing? Is it, a ground level walkout? I just want to make sure that our definitions are accurate. Otherwise, every finished basement that's the fire code or building code is also going to trigger this. So in that case, I agree with the shall is strong. I'm with you. We've gone back and forth with this. I like, Matt, your concept of calling it out. Why did we try to make this definition? Why don't we just call it what it is? We're trying to identify, are you turning your basement into a studio apartment? That may be fine, but just say, I'm turning it into a studio apartment, or something that could be a studio apartment, and then let's work on it, rather than, as we've seen before, it's a family room with a bed in it. Like, nope, then that's an apartment. So I kind of like including that spaces that, could appear something, ADU, studio apartment, in-law suite, au pair suite, whatever. I'm with you, just saying this is, or similar, so that we don't go, it's none of those things. It's this other thing that nobody thought to put in our list of potentials. I think that probably calls out and just makes it clear what the intent is. So we're all playing from the same playbook here. So yeah, no, I think adding that in, I'm just not positive where, and just want to double check the definition of that accessible exterior egress so that we're consistent. So we're not calling every fire escape window an egress. What are we calling it out? We're looking for walkouts or whatever.
Yeah, good points, Dan. Thank you. The benefit, remember, is that this doesn't trigger review unless you get 2 or more of the features. I don't think the board will be inundated with these. And so I think I'm a little okay with it being a little soft, or maybe a little too strict for a trigger until the board kind of gets a feel for it. Just change the regulations someday down the road. You say, like, you know what, this is where it should really be landing. This is what we feel better about. That it does include the windows meeting building code egress requirements, which gets to the point of basically if you have a walkout basement with full size windows on them, it's starting to look more like a living space than a basement. And in my opinion, that's where I would want to be doing that review. Not the little tiny 1 foot, window at the ceiling from your subterranean basement. And similarly, I know it'll be hard to figure out, well, what is accessible exterior egress? Does that mean not stairs? Is that one? What about one stair? Does that fall out of the rule? So I would similarly just want to keep it, I think, a little more open to say, yes, if you have usable exterior egress, then the board should glance at it. It doesn't mean we have to look at it and be like, oh boy, you have a bulkhead, so you're creating a suite downstairs. But again, it goes back to giving people and our health director just some direction so that they know, what are we looking at? What are we looking for? So if we don't have further comments, we'll say 2 is good all the way through the bottom of it. Maybe add accessible up to the exterior egress part. It says code compliant, whichever term we want to use there. Strike most of 3 and list out kind of what are the examples of the spaces that may be presumed to include additional bedrooms.
You can put bedroom and then the S in parentheticals.
All right, got it.
Awesome. Moving on. And last 10 seconds for anybody to debate the 400 square foot that we landed on. Great. 10 seconds. No debate. Move on. And this is all just new pasted in language.
Yep, so this is right from DEP's guidance.
Okay. In your review, anything that this board should focus on or particularly discuss?
Jim, have you seen any pushback on any items for the guidelines?
So this is essentially the guidance that DEP gave boards to address these ADUs, and it's as much a regulatory document as it is a policy document. The notion of the one bedroom, that kind of calling that out in an ADU, what they don't want is they don't want you to say, hey, this ADU has 3 rooms in it. You're adding it to a 7-room house. All of a sudden now it has 10 rooms. It should have a 5-bedroom house. They want you to add the 1 bedroom from this unit to that bedroom count of the unit. So again, I haven't seen a lot of pushback. And all of the language really, it kind of breaks down between whether you have a conforming system or non-conforming system and whether you're adding flow or not adding flow. So there's not really a lot of contention there. Those are pretty objective standards.
Thanks, Jim.
Now I see it talks about for if there's new construction that it meets the standards for the number of bedrooms, like in F. But for an existum, does that same language that talks about the number of bedrooms in the ADU?
So let's see for F system. So if it's non-conforming and you're adding flow, you'd have to upgrade the system.
Yeah, I guess that first bullet point says for if well, no, because it says F is about if an ADU is proposed to discharge to its own septic system.
Right. So then you look at the site. So now this ADU is on the site. So DEP looks at everything that's happening on the site. So let's say there was 3 bedrooms and you're putting a separate 1 bedroom on there, and the 3 bedroom already had a non-conforming system. Because you're adding a bedroom to the site, DEP makes you upgrade everything to full compliance.
Aha. Okay. So and perhaps it's a scroll up. Basically, I just want to see the same language where it says the system meets whatever standards for the number of bedrooms in the ADU, because that's the key thing. Can you point out right for that? Right, they're an A, right? An increase in the number of bedrooms on the facility. Then it's going to count as the number of bedrooms, right?
Yes.
Okay. That's
so if you have the right number of bedrooms and the system's okay, and you had a 2-compartment tank, you might be fine. If you didn't have the 2-compartment tank, but the leach field was fine, you may just need the 2-compartment. If the system wasn't big enough, then you're increasing the system to meet full compliance.
Did they give you a hotline to call when one of these comes up that you can ask this decision tree you were going through?
More importantly, they want all the calls to go to one number because they have a small group of people at DEP who are going to answer these. They've explained to us this is going to be a living document. So again, the two most important distinctions are conforming, non-conforming systems, and increase in flow and not increase in flow. That's really the kind of decision points.
Got it. Kevin Davis, did you put your hand up? If so, go ahead.
I did, and we might think if it makes it more clear, I'm not saying to do it, but if it makes it more clear, bold the words in the clause that you're trying to test for each one of the lines, so that way your eye will be drawn to what it means for each one of those lines. Not saying we need to, but if it makes it more clear for somebody, so that way they can say, oh, this is the line that I'm looking for. Oh, this is the line I'm looking for. It's just something to think about.
It is verbose.
So Kevin Davis, I believe, volunteered to make the flow chart to help you go down this decision process.
I do it for work. I could do it for here. Hence my comment saying, if you bold those items, it makes it easy.
Okay, go ahead and start scrolling, Francis, and we'll see if anybody raises their hand.
Okay.
Okay, let's get to section 6 then. Go ahead, Kevin.
What would be an example of documentation of an existing septic system's compliance with Title V?
Title V inspection.
So an existing home that was constructed in 2002 that has not, would it have had a Title V inspection to get its occupancy permit?
Yes.
Yeah.
So if a system got installed, it would have a certificate of compliance. And I'm hedging that if it was a new house at the time, that certificate of compliance would have been required for the occupancy permit.
Okay.
If we replace the system, let's say it was an existing house and you put a new system in 2002, you would have a certificate of compliance.
Okay.
Same document.
I'm more worried about a new house construction. You know, how did you get the occupancy permit? Do we know, was there a Title V that was done on it as part of the occupancy permit? I just don't remember. As an example, my house. I'm like, I don't recall.
Are you finishing your basement?
No. No. No, I'm just doing what if scenarios in my brain going, okay, if we do this, does this? You know, I'm just going through the list of what ifs, and I'm like, okay, so if we had new home construction, is that part of the paperwork that must be ready for an occupancy permit? And you just said yes, it is. So I'm like, cool, done.
I think the only thing I might add is on the first bullet point, just make sure that people understand the floor plans for the whole building, not just the floor we're talking about doing something to. So I don't know if it's existing or proposed floor plans. I don't know. Add some words in there to make sure people understand it's the whole house.
Okay.
Thank you. And then my only other one was on the third bullet point is we constantly say it's not about what you're telling us you're using it for. It's about what some future homeowner might look at it as. So what do people think? I would almost say don't call that out as a bullet point. People are welcome to tell us their story, but if somebody promises to me that that's being used as a yoga room, even though it has a closet and a nice window, that it will never be a bedroom, that's not supposed to matter to me.
Fair enough.
Board, anybody else? Thoughts either way? Davis?
Maybe if you want to put a label each proposed room
That's
on the.
that's in the first. That's in the first bullet.
Oh, room's clearly labeled. Never mind. I withdraw.
And that's why I think that should be. We just leave it as labeled. You people can still do it, right? People can still put some words on there, but leave it as labeled just so we do know where the dining room is, because there's no picture of a table and chairs. You know.
All right, so we'll strike
I agree.
bullet 3.
Kevin Baker, was that? Okay. Yeah, I think that's fair. I think we're done. Yeah.
Okay. So I'll get this out tomorrow to planning, conservation, and zoning, and I'll get comments back to the board as they're ready.
Awesome. Thanks, everyone. I know this has taken a long time. I think it'll be really helpful to us in the future and future board members. Kevin Davis. Yes.
Thank you so much. I do appreciate all the work that went into this. Also, are we going to send this off to legal to let them do the review?
Yes, and the AG's office.
Nice.
So other boards, feedback, we interpret that feedback. We think we finalize it, then legal.
Yes.
All right, that takes us back to let's go with our vote for reorganization of the board. It has been a year. And welcome back, Kevin Davis, to the board, and myself. I'm also back. And so it's time to shake up the leadership structure. Anybody wants to make any speeches? Now is your time. Dan Kane.
I would like to make a motion nominating Kevin Davis for chair of the Board of Health.
I'll second that motion.
We have a motion and a second. Roll call vote. Kevin Baker.
Kevin Baker votes yes.
Kevin Davis.
Kevin Davis votes yes.
Dan Kane.
Dan Kane votes yes.
And Matt Wason votes yes. Congratulations. The new chair of the Board of Health is Kevin Davis. Round of applause. Vice chair and secretary are our other two seats of power.
I'd like to make a motion to nominate Dr. Wason to be the vice chair of the Board of Health.
I'll second
No.
that.
No. We have a motion and a second. If
Do
I
you accept the
could briefly,
Do you accept the
before saying that,
nomination?
are you sure? I'm only saying this because I was just chair and Kevin Davis was just vice chair, and I don't want other people on the board to miss out an opportunity to further involve themselves in leadership positions. But if neither Mr. Kane or Mr. Baker want to do that, then I will be happy to take a vote on the motion.
Consider it, a great compliment. I think you guys have been doing a great job, and I think there's something to be said for consistency. And Dan and I are here to help with whatever needs to be done. So,
always, yes, I feel this board is very, very supportive of each other. So, we do have a motion and a second. So, roll call vote. Kevin Baker.
Kevin Baker votes yes.
Kevin Davis.
Kevin Davis votes yes.
Dan Kane.
Dan Kane votes yes.
And Matt Wason will vote yes. I will take the vice chair.
I nominate. I would like to make a motion. I would like to nominate Dan Kane as the secretary for the Board of Health.
Second that.
Motion and a second. Roll call vote. Kevin Baker.
Kevin Baker votes yes.
Kevin Davis.
Kevin Davis votes yes.
Dan Kane.
Dan Kane votes yes.
Matt Wason votes yes. Dan Kane is thus the secretary of the Board of Health.
Kevin Baker gets all action items, therefore.
Yes.
I'm good at that.
And as with most meetings, Mr. Fratelloni isn't here, so therefore he's not here to be not it, so he gets everything else.
That's right. We should create a new position. We should have 5 positions. We have 5 people. We should have something, right?
Yeah.
I'm equipment manager from this point forward. Okay. Mr. Chair, would you like me to wrap up tonight's agenda, or do you want to take over the meeting?
You can continue, sir. You're doing such a phenomenal job.
Very well. Thank you very much. This brings us to our administrative matters. First on the list is our signature approval for payroll and accounts payable.
So this is a yearly thing. Typically, whoever the department head they'd have to vote, and we would sign that type of paperwork. They sent it over to us, and they followed up with the recommendation that it might be better to do it over multiple years instead of just keep doing it each year. So it's up to the board, whatever they want to do.
I like our way. You never know when you have new people. However,
Sure.
what's new this time is that we have a director. Because historically, we've just, I think, typically voted to allow the chair to sign anything. So is that still the way to go, or do we empower the director to do it?
So I've already been doing it because we voted on it last year.
Oh, did we? Okay. So is that okay with the board? I see nodding heads. Dan's okay with it? Okay. It's okay with me then. So, yes, Dan.
Sorry, just a quick question. The letter from Michelle Reynolds, it's to Cemetery Conservation, Library Planning, Parks and Rec, Cable Advisory, and School Committee. It actually isn't to the Health Department or the Board of Health. I'm assuming they would also want us to make this determination and continue it, but it actually isn't addressed to us. So I just want to make sure that I'm not missing something, or she just didn't leave us off the list.
Yeah, I think that was a typo, but me and Megan figured it's just better just to bring it up anyway. So
Okay, nope, just want to double check.
So vote on this. Let's have a motion that we will follow that process in a second, please.
I make a motion to adopt the signatory and payroll requests for the Director of Health.
Second.
Motion and a second. Roll call vote. Kevin Baker.
Kevin Baker votes yes.
Kevin Davis.
Kevin Davis votes yes.
Dan Kane.
Dan Kane votes yes.
And Matt Wason votes yes. Please let us know if you need anything, any further steps on that. I know it says don't submit this till July 1st, so the start of the new year, but if you need anything, let us know.
okay, might need the chair to sign it, but it might be electronic. It should be fine.
Just
Fair. You can contact Kevin Davis for that. Next, administrative matters are meeting minute approvals. First, we have minutes from the April 23rd, 2025 meeting. Kevin Baker was not present, but I was, and Kevin Davis and Dan Kane were, so we can vote on them if they have been reviewed.
I'll make a motion that we accept the minutes for April 23, 2025 as presented.
I second that.
Motion and a second. Roll call vote. Kevin Baker.
Dane.
Kevin Davis,
Kevin Davis, yes.
Dan Kane,
Dan Kane votes yes.
and Matt Wason votes yes. Minutes for April 23rd, 2025 are approved. Next, we have the minutes for May 14th, 2025. I was not present, but Kevin Davis and Kevin Baker and Dan Kane were, so these also can be voted on if they have been reviewed.
Question.
Yes.
Is that link a clickable link?
From the April one?
Yes.
Yes.
Okay. All right. No, nothing further. It's all good.
So May 14th?
I'm good.
Make a motion to approve the meeting minutes of May 14th, 2025 as presented.
I'll second.
Motion and a second. Roll call vote. Kevin Baker,
Baker votes yes.
Kevin Davis,
Kevin Davis says yes.
Dan Kane,
Dan Kane votes yes.
and Matt Wason abstains. The meeting minutes for May 14th, 2025 are approved. Before we get to correspondence, I do have an update on our infectious disease decision support tool. So I will present that now. So the COVID-19 update is not very exciting. Same variant that we saw last time, the LP81 is the most common, about half the cases. Wastewater numbers are down, both below 200 for the first time in a long, long time. And our weekly case counts, as you can see on the chart on the right, have been very, very low. So that kind of paints a positive picture for COVID-19. I guess time will tell as if it starts to kind of really follow an influenza kind of pattern where there's a bigger spike in the fall and winter. It's highly likely. Or if it just parallels kind of when people get back together at school and such like that. So we will keep monitoring it, of course, but those are the numbers. I have popped open the arbovirus section because although testing technically begins in June and it is only May, the state has started showing the risk maps. So for EEE, we are currently at low risk, which is technically not the lowest level risk that they show on their chart, but it is what this area generally starts at the beginning of the season. And similarly for West Nile virus, low risk currently. Influenza was low, is still low. So I will kind of officially close that section for the end of the season. And similarly, RSV, which was quite low last time we reviewed it, similarly low. So we are out of those two respiratory viral seasons, and now it's time to just focus on our COVID and our mosquitoes. Any other questions or topics to bring up? Go ahead, guys.
Go ahead, Francis, you first.
I was just going to add on to mosquitoes. So today we sent out a news flash to the town about abandoned pools. Central Mass Mosquito will treat them, and it is a free service. So anybody who does have an abandoned pool or a neighbor who might have one, if they reach out, we can get them in contact and get a contractor out there to treat it.
Have we also let the town know that Central Mass Mosquito Control is the people to come out and contact and let them know that they will come and treat your property for mosquitoes and all that kind of good stuff?
Yes, we did send something out, I think, a month and a half ago when they were starting operations. And we'll just continue to communicate through the summer, and we have our webpage as well.
Okay.
So technical question. I saw the email from the town email, and then it links to a page, but I don't see it on the health department front page.
I don't have it on there. We sent it out through the main stream so that everybody would get it.
Okay. Because then my other request is, this isn't the first time, and it might be out of our control entirely, but the number of times that I get a town email that actually includes a link to a PDF, and the number of times we tell people not to click things in emails whenever possible, is one of these like, whatever the information is in that PDF, why isn't it just a web page that we can be sending people to as opposed to creating another step? Because I think it becomes a barrier, especially if somebody's on their phone and now trying to open up a PDF on their phone, which takes a couple more steps. And like I said, I know it's not in our control because I'm guessing that we didn't create the PDF. We're just trying to connect people to it. But if there's any sort of way to, when it comes to our email from our town or our web page, if we can have some summary information or links just to more web pages as opposed to documents. I just throw that out there. I actually didn't look at it because I was on my phone. I was like, another PDF. I just don't want to deal with it right now.
Thanks.
But which is why I went to then our homepage because I said, it should just be on the health department page, but I didn't see it there.
So
I bring it to IT. Yeah.
couple of things. The state publishes all of their stuff either in HTML or PDF. They don't send out any other document type or things like that. One of the reasons why they send it out in PDF also is for 508 compliance, because that'll naturally take care of it. And some of the new PDF readers also do translation. So that's also a good thing. Whereas HTML, you have to have a 508 compliant section alternate text, and it may or may not be in the appropriate language.
Send the PDF as a link at the bottom. I don't care, but give information in the body. That's all I'm getting at. Whenever somebody has to take extra steps, they're just less likely to actually get the material.
Not disagreeing.
Right? Like I was saying, the number of times the town sends information by email and there's more space spent on logos and headers and footers than there is on content because it's a link that you got to go work for. So, like I said, it might be totally out of our control, but I think we could do better.
I'm not disagreeing with that. I'm just letting you know the reasons behind it.
Regulations don't bother me, Kevin. You can focus on those. Okay. Then I think that's it for the ID tool there. So that brings us to correspondence. What correspondence do we have to discuss? Dan.
I have an operational question. I had someone reach out to me today regarding the Masonic Lodge. They spent the last year redoing their kitchen. They had a small incident. It sounds like not a big deal. However, it prompted a fire response who went, whoa, 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 from the fire code side of things. And a number of other folks got involved, and they have redone their entire kitchen. I believe they're done or they're close, but one of their officers reached out and had questions regarding the inspection process, the licensing process for their kitchen, as well as the training requirements for their staff. Most of the time that it is used for members of the organization, but they do things like pancake breakfast and some of those kinds of things for the public, which kind of changes the criteria, I believe, as soon as they open the doors to others. So really, they just had some questions around choke saver training, serve safe training, inspectional and licensing requirements, some of those kind of pieces. So I said I would reach out to Francis and Jim tonight when I have my meeting. If it's okay with you, I'll double check with the officer if it's okay for me to just give you guys their contact info and you can kind of address, because it is a little bit of it. I mean, we have other clubs in town, and what Calvetta over in by the lake, and we've got VFW. I'm not sure if they have a real kitchen, but we have other organizations like aren't a church but aren't a restaurant but have a kitchen that's sometimes used outside that weird in between zone. So as long as it's okay with Francis and Jim, I will reach out and see if it's okay just to put them in touch with you directly to figure out what exactly is required for serve safe and choke saver and all that kind of good stuff, signage and that stuff. Even as a club, they're still going to need to be inspected and anyway, right?
Yeah, we've reached out to them a couple of times about that. So a contact would be great.
Okay. Yep. I will double check with the person who reached out. As long as it's okay with them, I will connect you guys by email tomorrow offline.
Definitely.
Perfect.
Thank you for bringing that back. Go ahead. Keep going.
Sorry, this is just a minor one. For our agendas, is there a way that we can add, particularly for like the address ones, a topic? So it's like tonight we had just 2 Elmwood Road as a public hearing. Is it a housing issue? Is it a Title V waiver? Can we just add a kind of a topic along with it so it's not just an address? That might be helpful both for us, we see the packet, the community may not see a packet. So having just a sense of, oh, they're redoing the septic system, or they're doing an addition, or wait, we've got a significant housing issue. Just that I'm not sure if we necessarily need to hit the agenda is supposed to provide at least an understanding, a basic concept of what's being discussed. I'm not sure if an address quite reaches that threshold. It might. I'm just not sure, but
Fair enough. Yep.
Good point. Any other correspondence? And that just brings us to board member updates. Kevin Baker?
I have no updates right now.
All right. Kevin Davis?
No updates. I actually went, oh, maybe this is an update. Sorry. I actually went to the filtration or the sensors, and I'm not seeing more sensors on around town, or did I just not get to the right page? So I can take that up offline with you, Francis, to see what's going on. But yeah,
Are you referring
Yeah.
to our air quality sensors?
yeah.
We did have some problems in the beginning because they had to change out outlets. I'll have to check. I haven't looked lately, but yeah, we can connect tomorrow.
All right, perfect. Thank you. That's it. Nothing else.
Yeah, I'm still seeing at least a few around town. But you can check. Dan Kane, any other updates?
nope, nothing else. Thank you.
Any updates from Jim?
I do not.
Thank you. And any updates from Francis?
Nope.
And
Very
any
well.
update from Megan?
And I don't have any updates either. What was that, Kevin?
Any updates from Megan?
Any updates from Megan?
Nothing on my end.
And we have no audience members to ask for input. So that wraps up our agenda for this evening.
Where's Gino?
Go ahead, Dan.
I'll make a motion that we adjourn.
I will second that.
Motion and a second. Roll call vote. Kevin Baker,
Kevin Baker votes yes.
Kevin Davis,
Kevin Davis votes yes.
Dan Kane,
Dan Kane votes yes.
and Matt Wason votes yes. Thank you all for a good meeting. See you
Thank you,
next
everybody.
time. Thank you,
Thank you,
Jim.
everybody.
Thank you, Francis.
Good night, everyone.
Megan.
Thank you.